Do you have a loved one that suffers from dementia? Dementia is a general term for memory loss. Dementia interferes with a person's day-to-day activities, such as social skills and thinking abilities. Dementia is also known as Alzheimer's disease. Approximately about 50 million people worldwide suffer from dementia. Also, there are nearly 10 million new cases every single year. Dementia in a person can be can put them at high risk for safety concerns. Forgetting to take their medicine, forgetting to eat or drink, forgetting that they have stairs in the house, forgetting who you are, forgetting who their caregiver is, can put them at risk. This is why a person with this diagnosis needs to be in a facility where the patient can get the adequate help, guidance, and treatment for when these conditions arise. Even though at the moment there is no cure, there are medications that can help slow down the progression of Alzheimer's disease or dementia. Some patients can even develop a condition called sundowners. Sundowners is when as the sun starts to set, the resident or patient can become agitated, aggressive, violent, and if the patient is at home, can even cause their caregiver to leave and have nobody to care for them. So if they're at a facility, they can provide different staff to help cope with this condition. They may have to switch out the caregiver, provide a new face, provide redirection. They can give medication if needed to calm them down. A family member may not know these techniques because they are not specifically trained in dementia or Alzheimer's. However, the patient can be handled in these certain circumstances that a family member may not be able to. I know it can be hard to let your loved ones go, but this can alleviate stress, anxiety, or the feeling of being overwhelmed. You can be overwhelmed because you may have to care for them all the time or trying to find somebody else to care for them because they don't want you there, or you can be sad because they don't know who you are. So you don't want to be, you may be upset about what's all going on too. So you may not be in the best shape to take care of that family member while at home. This is why being in a facility could help that person. While the family member with the diagnosis of Alzheimer's or dementia is in a facility, all family members can come visit. They can even go on day pass, depending on their stage of dementia they're in, and also depending on the facility's procedures and protocols. They can even go and spend the night for a day or two, or for the weekend, or they can go for a day while you go out to eat and spend time with them and bring them back. And you can always come and visit the facility, but you just have to make sure you check with the facility procedures and protocols. But spending time with the family is a great thing to help with the condition. You want them to spend time with the family. You don't want to take that away from them. Dementia can be very scary for some family members that have never experienced it. Like, they don't know what's going on. Like, why my mom doesn't know who I am? Why does my dad don't know who I am? Why does my sister don't know who I am? It could be very scary. So the facility can also help with you dealing with that. Like, let you know this is a part of the process. Getting you to may have outside resources that can help you cope with this as well, because it can be stressful. This is why it is good for them to be in a facility so you can all have access to all these resources. Facility has special staff to help you cope with this process, but the most important thing about having your loved one in the facility is knowing that they are safe. Is knowing that they will get that adequate help for all of the things that happen. Like, these facilities are specifically trained to deal with Alzheimer's, because we know that it is a growing condition, because they know that there is no cure for this. They are building more facilities to help facilitate this condition, because it is no cure. We don't know how it is going to affect people, so they have to train these people to adequately facilitate this person when they have these conditions. Your loved one will be dealt with at a professional level. There will be different people in there to help. They will have a team of doctors, nurses, aides, social workers. They have a whole team dedicated them to provide a care plan specifically for them. The family will be provided insight on all of this. You will go through step-by-step process, and it also helps, with your stress, with the anxiety, the fear of the unknown, and that's just why the facility can help the patient, the family, deal with Alzheimer's. Thank you so much.